Joining us now once again, Representative Anthony Weiner. Representative, where do we stand with the public option in this debate?
Well, the White House now is back to where they were, and which is, it seems like they support it, they prefer it. I think we are at the point now the president really does need to stand up and say, here are the things that we need to have in any bill that passes, and one of them has to be a public option. I think it's pretty clear that he doesn't have the votes to pass something that doesn't control costs, and the public option has been the only way described so far that really does that.
What do you make of Steny Hoyer's comments at the end of last week suggesting that the public option may have to be gone in order to move forward?
Well, look, everyone is trying to figure out the math on how you get something passed. He might be under the impression that you get more votes than you lose by taking out the public option. But Nancy Pelosi, who's the best vote counter anywhere, the Speaker of the House, she said clearly and crisply as soon as there was any indecision coming out of the White House that she would not put a bill on the floor that didn't have the public option. And I think that's important. Look, here's the bottom line. When your viewers hear about the public option, for most Americans, they're not going to have it, at least for a few years, till they have an opportunity to go choose into it. But immediately the competition that it creates, at least in theory, is going to lead the insurance companies to say, you know what, we got 10% profits last year, we might have to cut it down to 6 or 7, and that's why it's so important to controlling costs.
And that's exactly where I was headed. The debate goes back and forth. The Congressional Budget Office has their number. The people who have a given political plan have their numbers. The outside world has their numbers. Walk us through your mathematics as to how the use of the public option ultimately reduces the cost of health care while providing more of it to more people, in brief.
Well, here's how it works. Assume the average family pays $12,000, $15,000 a year to their private insurance company for insurance. They really don't have the ability to go to the insurance company and say, hey, can you make that $10,000? So the only thing that would force them to do it is if that insurance company knew that, hey, you know what, there's a competitor out there that's offering it for 10. I better figure out a way to get down to that price or I'm going to lose this family. Now, that's the theory. I think that part of the problem is that you need to have a really muscular public plan to do it, and as you know, I believe in a single-payer plan like Medicare for all Americans. Why even have the private insurance plan? But the controversy is that some on the right say, oh, that kind of tough competition no insurance company can stay up with, and some of us say, well, if they can't compete, then they shouldn't, and if people are going to choose the public plan, then that's just the free marketplace working.
Well, but that's a little disingenuous in that the public plan doesn't have an overhead, right? And there's another argument that says, well, listen, why should we fund an overhead? I understand that, but from a pure competitive standpoint, the public option is just as anti-competitive as any sort of barrier to entry that might protect an insurance company. No,
only if you consider overhead. The taxpayers paying for TV commercials, the taxpayers paying for big bonuses, the taxpayers paying for huge administrative costs. Medicare, which is the best example of what a public option might look like, has a 4% overhead because they don't do those other things. We as consumers just want health care. We're not interested in fancy TV commercials, and if maybe the insurance companies say, you know what, we're going to give our CEO only $1 million this year rather than 5 so that we can compete to keep prices down. That's why the marketplace right now is inefficient, because most people have no choice at all. They get their insurance from their employer, and that's it. Take it or leave it at whatever price the insurance company wants to offer.
Let's talk, if we could, about the Medicare cost savings, which is part of how at least the House proposal gets into saving money. And an editorial from Michael Steele in the Wall Street Journal today. I want to read a quote from him, and he's again referring to the Medicare plan and the cost savings and the president and the House plan. He says he and the congressional Democrats, he being the president, and congressional Democrats are planning to raid, not aid Medicare by cutting $500 billion from the program to fund his health care experiment. Again, referring to President Obama, the president also plans to cut hospital payments and Medicare Advantage, all of which will mean fewer treatment options for seniors. In essence, Michael Steele says this health care reform is coming at the expense of America's seniors. Your thoughts on raiding, not aiding Medicare and the role and the impact on seniors?
Well, first of all, what this amounts to is about a 10% cut over 10 years to Medicare. And the thinking is that we don't want to do anything to people's premiums or the quality of the care that they're getting, but we have to get some efficiencies. We have to be able to save costs, or else this whole thing is not going to work. So let me give you a couple of examples of what's contemplated in that $500 billion cut?
Please.
Well, someone says, you know what, we want to figure out a way to disincentivize someone from going into a hospital bed for $700 a night, so instead we're going to pay to have home care attendants a couple of days a week to take care of a senior in their home. That saves a lot of money. It makes the senior happy, makes the taxpayer happy. That's the type of thing that we can do under Medicare. Now, if we wanted to do it in the private insurance sector, what would we do? We'd buy stock in the company, or we'd get an 800 number. We in Congress or the taxpayers would be powerless to do that type of thing.
Yes,
but that type of savings we're going to have to get. We cannot continue on this arc up and up and up, but it's so ironic to listen to the Republicans so concerned about Medicare when they have been against it and cutting it every year since it was created.
Representative, thank you for the time. Enjoy the rest of your week.
Thank you.